Spine fracture in ankylosing spondylitis is a challenging situation. Normally what happens in ankylosing spondylitis, the entire spine fuses, that is, it becomes like a one stick. So it is like a long bone fracture. So whenever there is fracture in a patient with ankylosing spondylitis, the chances of nerve deficit or non-union are high. Normally there are three challenges. Number one, this fracture takes longer than normal time to heal. Second, it is a 3-column injury in which the chances of nerve deficit are high. And third, it can sometimes progress into something known as Anderson lesion, in which the non-union side starts moving and there is pressure on the nerve because of chronic compression. So normally, whenever there is a patient with ankylosing spondylitis and there is a history of back pain, or if there is any history of trauma, or the X-ray or MRI showing that there is some problem, then we should always consider the possibility of fracture. If at all there is a proven fracture in the spine in a case of ankylosing spondylitis patient, then it requires three special precautions while treating. First of all, the positioning on the table. The table is also a special type because while positioning the patient, we cannot change the curvature of the spine. So we position the patient as the normal curvature of the spine is, which requires a special table. Secondly, we use neuromonitoring for this surgery, in which we continuously monitor the nerves of the spine so that we can see the progress of the surgery. Thirdly, we need special type of fixation techniques. Like this fracture in ankylosing spondylitis is treated as a long bone fracture requiring longer fixation, maybe bone grafting, or if some amount of curvature correction is also required, that can also be tried. So fracture in case of ankylosing spondylitis is a special type of fracture which requires special care, special treatment plan, special operation theatre setup, and special care like neuromonitoring is also required. Also, this fracture takes longer than usual to heal. Normally, a spine fracture takes 2 to 3 months to heal. But here it can take up to 6 to 8 months because the chances of fracture going into non-union is high. So we need to protect the patient in a brace for a longer period. Thank you.